So good morning, everyone. My name is Kirsten Bayer with the Illinois Center for Specialized Professional Support at Illinois State University, and I will be your moderator and technical support for today's session. Today's Workforce Wednesday webinar is Successful Case Management in a Virtual Setting, and we are joined by Jody Sue Kelly. We have had her present on a multitude of topics before for us, so we're excited to welcome her back. Before we get started with her, though, we're going to do some housekeeping items. Jody, you can go ahead to the next slide for me. Thank you. So again, my name is Kirsten Bayer. I am with ICSPS. I am the Digital Communications Manager there, and I will be the tech support and moderator on today's session. So if you need anything, if you have questions, feel free to reach out to me directly via the chat. You can go to the next slide for me, Jody. Couple of housekeeping items. I'm going to put up our polls. These are our analytical polls that we do for every Workforce Wednesday webinar. So first, we just want to know where you're joining us from this morning in terms of the state. So where's your local area at? I'm joining you from Central Illinois. And so I relate to all of you fellow Central Illinoisans. But while that poll is up and you all are answering it, to go over some housekeeping items, we are on Zoom webinar, not Zoom meeting. So the difference is that you as an attendee do not have the option to unmute yourselves. And so we will ask for all questions, comments, or concerns in the chat or the Q&A. It's a little bit more of a presentation format for Zoom webinar. And so we're excited to present that to you today. So if you have any questions, we are going to have time for a live Q&A towards the end of the session. Feel free to type those in the chat so you don't lose your train of thought, and we will facilitate those at the end of the session. You also tomorrow will be receiving a follow-up email, and in that follow-up email will be the URL link to our website, and there you will be able to find the recording of this session, so it is being recorded, as well as the presentation slide deck from this session. So if you have a coworker who you feel like would benefit from this session, but they're not able to attend this morning, you can feel free to pass that recording along. The presentation is available to you right now, so I will put that URL in the chat momentarily here, and you can download it if you wish. And so that follow-up email tomorrow will also house a follow-up survey. And I'm going to go ahead and end this poll and share the results really quickly before I continue with the housekeeping. So it looks like most of you are joining us from, we have a multitude across the state, a lot of people from Chicago and Northern Illinois, but quite a few from down south as well. So thank you for joining us this morning, everyone. Our next question, if you want to go to the next slide for me, Jody, is just which partner do you best represent? So if you best represent Title 1, 2, 3, or 4, or if you're another WIOA partner or stakeholder or a state or local workforce innovation board member. So while that poll is up, I'll continue with the housekeeping items. So we have a follow-up survey that we will put in the chat towards the end of the session, but we also will have that in the follow-up email. And so we just ask if you could take a couple minutes out of your workday to provide us with feedback regarding this session. And if you have any other WIOA PD that you would like to see, we do look at those surveys. The WIOA Professional Development Committee does. We are actually doing a report right now towards the end of the year to start and continue planning professional development for 2023. So we will be looking at those very in-depthly. We look at them every week. So we welcome your feedback. It's always good to hear from the system, and we want to provide you professional development that you want. So please feel free to take that follow-up survey. Again, it'll be in the follow-up email, and I'll put it in the chat towards the end of the session. So I'm going to go ahead and close this poll now. It looks like a lot of people from, I'm sharing the results, Title I and Title II, and we also have a lot of other WIOA partners and stakeholders. So thank you for taking that poll. I always appreciate your participation. If you join us on a lot of Wednesdays, you've probably taken that poll a multitude of times, but we always appreciate your participation. So I'm going to go ahead and hand it over to our presenter today, Jody Sue Kelly, and let her introduce herself. And I'll be here if anybody needs anything. Thank you.
Hi, so I'll just briefly give you my background because I really want to get to the content. I've actually been in workforce for 44 years, and my initial start way back in 1978, actually, was I ran youth programs in the Pittsburgh, Pennsylvania area for about 7 years. And then after that, I started traveling and training around the country. I primarily do topics that are for line level staff. So my interests are recruitment, case management, job placement, employer outreach, teaching job search, job retention skills, but also then I do seminars and meetings on job retention and career advancement, motivating customers. So anything that my passion is working with people who actually work with the participants. I have a degree in psychology and my master's is in information systems. So today we're here to talk about case managing in a virtual environment. And to get started, what I wanted to do was just take a step back and review where we've been and what expanded the whole concept of virtual case management. So back in 2020, as you can all remember, the COVID-19 pandemic really forced agencies to rethink how they were going to deliver services with social distancing, with masking, with just constraints on interacting with our participants. So agencies had to quickly pivot from pre-pandemic challenges to these new challenges. So as this hit, we all had to adapt very quickly just to try to ensure a continuity of service and not have huge gaps, in March and April and May of 2020. So our participants still had like needs with or without the pandemic. And those needs were really exacerbated just by the pandemic. Unemployment went up, housing became a problem, there was food scarcity and the like. And so across all social service agencies, this was a challenge, whether it was like trauma, substance abuse, child welfare, workforce development, et cetera. So there was no social service agency that was not impacted. So the vast majority of workforce programs shuttered their doors during this, except for, they shuttered their door to non-emergency appointments. And in many cases, virtual case management really became the gateway for case managers and participants to stay connected. So we had to very quickly develop these systems. One of the things agencies had to do was to establish and scale up virtual case management. And there were lots of challenges. I mean, staff in many cases had to set up home offices in homes that had space constraints. I mean, a dining room table is not an ideal office location or office space. Staff didn't necessarily have the capability of the kind of internet that was needed for the kind of case management that we needed to do. And they didn't oftentimes have all of that in place. And then add to that schools were closed, and that created even more of a challenge for both staff and clients. So in most places around the country for many months, it was just a hot mess. So in normal times, notice that you could develop a comprehensive remote system that would involve planning and piloting and adjusting before you began some wide-scale implementation. But agencies didn't have the time because the urgency and complexity really required immediate action. So because we didn't have that time to plan, and the economy was shutting down, even more people needed our service. So really the pandemic impacted every aspect of case management: recruitment, intake, assessment, job search, job placement, job retention, just across the board. And literally we were building the plane while we were flying in it. So while the pandemic created these major challenges and impacted our lives in all kinds of ways, it also provided an opportunity for us to rethink our services for the long term. And now that we're on the other side of the pandemic, agencies are really grappling with, where does virtual case management fit into this post-pandemic world? But having said that, because of seasonal flu, RSV, and COVID. I just have read in the paper in the last couple days, been seeing news that many places are re-implementing or certainly recommending that we at minimum go back to masking and social distancing. So I basically believe that virtual case management is here to stay, because there were real advantages to being able to connect virtually with participants. There were challenges, and we're going to talk about that as well. But what I want to start with is what are some of the benefits? And then we'll address some of the challenges. So there was a lot to like about virtual case management. I mean, speaking generally, virtual case management provided very convenient access to our services. It opened up services to those who would have difficulty coming into our offices for a host of reasons, including transportation, childcare, but also just fear of COVID and fear of the results of the pandemic, just to name a few. So we had to very quickly work to offer services in different ways: online classes, virtual case management, more use of texting, telephone counseling. We had to develop ways to stay socially distant, but also still build enduring relationships with our customers. So there's one program, and I'm going to talk about this in a bit later as well, but I'll introduce it now. It's called Strong Fathers and Stronger Families, and it was in New York City. And there was a research project that happened to be going on during COVID. So the researchers looked at what were the impacts of COVID on the way in which the program had to shift in order to include all these virtual services. And so they outlined in their final report some of the benefits, and some of those I'd mentioned. It's more convenient, but it's also a more effective use of time. You didn't have clients sitting in waiting rooms or, waiting to be called. Reduced child care issues, travel, expanding of the customer base, but it also added a lot of flexibility to the way in which we delivered service, because now we were doing online classes, we're doing virtual case management, and it increased the skills of staff, but I would also argue of the clients who had to begin using all of these virtual platforms. And in this case, like Zoom, Microsoft Teams, and other GoToMeetings and other platforms as well. So what many planners, the people in the forefront trying to make this shift, had to do was look at like who's already led the way. And across the country, that would have been telehealth. Because for several years prior to COVID, doctors began using telehealth for elderly patients, for rural patients, and for those who just couldn't get into a doctor's office. So telehealth really paved the way for the rest of us to follow. So let's look at what they learned about how satisfied patients were with this new way of receiving service. Overall, the results of telehealth have shown that patients are really happy with telehealth service, and they don't want to see it go away. Patient noted that there was decreased waiting time compared to in-office, because you just log on like 15 minutes in advance and the doctor would show up in a telehealth visit. Overall, patients reported on the convenience, like they don't have to miss work or class. They could do these appointments right at work. They didn't have to travel. They didn't have to fight traffic. They didn't have to park. They didn't have to find the place. They didn't have to wait. And I think those are some of the same benefits that we can accrue. And most patients said in their survey of satisfaction that they felt very comfortable talking with their doctor via video. And I know I had one telehealth appointment with my doctor, and I found that when I would go visit in person, and I'd visit Dr. Hamilton in the office, he was always staring at his computer, click, 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 like he was typing, searching for things, and almost established like no eye contact. I'd be like, hey, remember me? I'm like sitting right here. During COVID, I had to have a telehealth appointment, and I was like shocked. He established eye contact. He was much more personable, and he was actually much more attentive to me than to the computer. I totally preferred it. Now, not if I like broke my leg, I need to go in, but for the kinds of things that, simple things, I no longer had to do that same stuff, go park, get into the office, wait in the waiting room. And then they always have outdated magazines that I didn't want to read. So something else that the telehealth surveys of satisfaction found was that in some cases, the caregiver and family member remarked that on the just the ability to be for them to be incorporated into the office visit. And I understand that too, because I had a 92-year-old mother-in-law who lived with us. And when she needed to see a doctor, oftentimes I was the one at home, and I was able to use the technology to include her daughter and my husband, who were her real children. I'm just an in-law. And, without that technology, it wouldn't have been possible. And, I felt like they needed to be part of the healthcare decisions that were being made. So I think for us, the ability to be able, like with a youth, to include a parent or a spouse or a significant other into parts of the call with our participants can have real advantages. Now, not all the time, not with all participants, but in cases where the other person would benefit by being a part of the decision-making process, virtual case management can really be a plus. So now on the flip side, and during this telehealth study, a few patients did note that there was a loss of personal feel in the face-to-face visit, but even then they did not consider that to be a significant limitation. So one of the questions and one of the challenges that we face, as does telehealth, is just access to technology. So I looked at two studies because I wanted to know, like, who even has computers, who has smartphones, who has tablets. And these two studies gave some insight into who has access. So one was KFF Health, and the other was Pew Research. And so they addressed the question of according demographically to who has computers, smartphones, or tablets. I was actually sort of surprised by the results, because KFF Health found that the number of adults who have a computer, a smartphone, or a tablet is much higher than I would have guessed. They said 70% of people 65 and over and older have access. 85% of those who are between 50 and 64, and virtually all of 30 to 49-year-olds. I cannot address why they didn't go lower to like youth up to age 29. But anyway, Pew pretty much confirmed those same findings. So I asked I teach a class of 165 people, and the people that are in my class this year are all work with migrant and seasonal farm workers. So some of the folks economically who are at the lowest end of our economic scale. And I was asking her, like, what percentage of your participants have a cell phone? And I know it was anecdotal, and it's not like the KFF research or Pew Research, because I'm asking one person, but anecdotally, this is in Kansas, rural Kansas, where she's from. She said is 100%. They all have cell phones. So let me bring those results to you and your local experience. So let's, Kirsten, if you can go ahead and put up our first poll. What my question is, what percentage of your participants have a cell phone or laptop, and what percentage have internet access? You'll have to scroll down and do both questions.
We'll give everyone about 30 more seconds. Okay, I'm going to end the poll.
Okay, so it looks like the vast majority have a cell phone, laptop, or tablet, and it's somewhat less on the internet service, which can be a problem. People have to go to a library, they have to go to a Starbucks, they have to go somewhere. But what I want to, let me move to the next slide, is then to talk about some possible solutions for those clients who either don't have the equipment that they need or are lacking internet service at home. And maybe some of you are already working on this or aware of this. I'm going to just go quickly over some information. So there's a new program, fairly new program, called the Affordable Connectivity Program, and it's called ACP for short. And it's a long-term, it's a $14 billion federal program created through the Infrastructure Investment and Jobs Act to help low-income households pay for internet service and also to get connected devices. It's an initiative that provides discounts for broadband internet services and devices to these low-income people. And anymore, like internet access is basically essential for work, for school, for healthcare because of the move to telehealth, and for most types or almost all types of virtual case management, unless you're only using a telephone. So there are two ways that the ACP program can help participants. The first is that they can get discounted services. So the ACP program provides eligible households $30 a month or less, which less is sometimes $0 a month, internet services. So there are 1,300 participating internet providers across the country last time I looked, and I think that that's growing every day. The FCC have said, the Federal Communications Commission has said that 40% of Americans will qualify for the program according to the statistics that they have. Sorry, my finger hit the mouse. I still am not back to where I need to be. That was the poll. There we are. So anyway, so that's the first, is that they can get internet for $0 to $30 a month. And the second is, if they do not have a computer or a tablet, then eligible households can also receive a one-time discount of up to $100 to purchase a laptop, a desktop computer, or a tablet from participating providers. And the rule is that the participant themselves only has to pay a maximum of $10 to $50 toward the purchase price. So they can basically get a laptop or a tablet that $150 or less. So they're not getting the highest quality, fastest computer or tablet. They're getting, a basic model, but for the kinds of things that we're going to need the participant to do, that is totally going to be sufficient. So if we look at who's eligible, and you can go online and look at all this, so I'm not going to go over every single criteria, just want to make you aware this program exists and it's active now. The income level under previous programs before the Infrastructure Act was 135% at or below poverty, but the ACP program raised that level to 200% of poverty. And again, 40% of Americans are going to qualify. So if a person receives SNAP, Medicare, public housing, Social Security, disability, WIC, or are currently under the Lifeline program, which is primarily for seniors, then they would qualify as well. So these are ORs. If you're 200% of poverty or below, or qualify for any of these programs. Or if your family is receiving free or reduced lunch, they'll qualify. If somebody is getting a Pell Grant, they would qualify. And then internet providers themselves, Verizon, Comcast, Spectrum, Charter, all of those also have their own low income program. And if a person qualifies for a provider's low income program, they also qualify for ACP. And then tribal, TANF, and general assistance recipients through tribal programs also will qualify. So I went online and I looked at, well, who's in Illinois? And I didn't want to add pages and pages and pages because you can just look this up. So I only copied Illinois vendors from A to M, and most of those are cut off the page because of my graphics. But I know that each area has a set of providers who participate, and given that 40% of the population qualifies, it actually behooves a provider to participate in this program. So you can look this up. I've listed the website and get the complete list of, you can look by zip code, you can look by area. I just looked at Illinois as a state. So the point is, there are solutions that are available for helping people to get a device and getting broadband internet access. So I want to move and I want to do another poll, because even though like we can help them now get internet, or we could help them now get equipment, getting access to technology is one part of the issue. But the second part of the issue is we have to recognize that all people use technology in different ways. So I'm going to have Kirsten put up another poll. And my question is, so if a family member or friend wanted to reach you, so take this personally, then which of these methods of communication would likely get you to respond first? It looks like, Kirsten, that we have all but 11. So do we want to end and move forward?
Yeah, so I just shared the results so you can deep
Okay, so just reviewing this poll, I think that we can see by our own results that we all have preferences, that we are all different. I see, if I'm reading this right, we have 4 call me on my office or home phone, call my cell phone, text me on my cell phone, or send me an email. What is interesting is 0 people, I find it interesting, is leave me a voicemail. And I find that interesting because I was just on a session with Department of Labor, and the staff person was, they were talking about doing follow-ups post-placement. It was around performance measures. And DOL asked, well, how do you reach people post-placement? And the guy was saying, well, we try to call them, and if we can't reach them, we leave a voicemail. And even as he was saying it, I thought, oh my God, that's like the worst way to reach me. If you leave me a voicemail on my home phone, I don't even know how to pick up the messages. So, and it doesn't beep because there's no longer an answering machine. So I can't see that I have messages, and mostly all I get is spam. But anyway, we all have our preferences. So where I want to go with that is basically to say one size doesn't fit all. not all clients have access to the same technology. And even when they do have access, just like us, they have preferences. So like example in my own life, my husband, Tom, if I send him a text message at work, because I need him to, I don't know, pick up milk, or somebody's called and I need to get this message to him. I've learned over our years of marriage, send him a text message while he's out of the house. He will most likely read it at night after he gets home from work. So if I really need him, I have to call him. And my second best method of reaching him, if he doesn't answer his phone, is send him an email through his work. He looks at his work email. But I have a niece, Brittany, and I can go on and on with each family member. I'll just tell you one more. She's 20. She will respond to a text message in a nanosecond. But if you send her an email, she may never see it, because for whatever reason, she doesn't like email, isn't part of it's not part of her repertoire. And I will tell you, my nephew Gio, he made me, to talk to him, I had to download Snapchat because he doesn't text or check his text. He doesn't, he'll see a Snapchat like almost immediately. He's about 11. I just did mock interviews with some juniors at our local high school. They try to do mock interviews with 900 students over a 3-day period. So I did mock interviews maybe with 20, 22 people. And I asked each student about their social media use, and 100% of them, 100% of the youth said that they use Instagram and Snapchat. 0 said that they use Facebook. They didn't even have Facebook accounts. So we need to know what their preferences are and their current patterns. And that isn't to say that we can't help them to develop new patterns in using us, but we initially need to look at what already works with them. So what, a recommendation that I have is, I think more now than ever, we need a technology assessment up front as soon as possible, so that we can begin to plan the best structure to serve this particular participant, because each participant's going to be different, just like we are. And I need to know the best method for reaching them. So I recommend conduct an initial assessment to determine who already has what, and if there's again a way through ACP to help them get something cheaper. So these aren't a complete set of questions by any stretch of the imagination, but do you have internet or Wi-Fi at home? And if they say no, talk to them about ACP. Do they have a mobile phone? Do they have a computer at home, a tablet, or other device? Again, ACP might be somewhere I'd refer them. And do they have an email address that they use regularly? Having email and using it regularly really is a whole different question. And then I think that we have preferences. So we need to know their preferences. So we want to continue the initial assessment to determine what's the most appropriate technology. So we should ask them about their current use, and then we'll also ask about their comfort level. So again, I've outlined some questions about their preferences and habits. Again, it's not a comprehensive list, but a sample. So if someone, question I just asked you, needed to reach you quickly, what's the best method? How often do you check email? My niece Brittany would say like rarely. How often do you check your text messages? Multiple times a day, or like never? That would be my husband, or rarely. And how often do you check for telephone messages? Me. Very rarely, because I don't know how on my home phone. On my cell phone, I will get a notification, so I will. But I have people, my brother, you can leave him a text message or a voice message. He won't listen to it. He'll just see that you left one, and then he'll call you. And then my last area that I would look at is then what are their usage patterns? How comfortable are they? So on this, I'm asking whether or not they have previous experience with online learning. How comfortable are they with using internet? And I would also ask them, like, have they ever used video chat before? Do they like learning new technology? Do they see any connection between learning this new technology and how that might help them in a future job? Do they use online calendars so that we could set up appointments and send them links that they could put on their calendar? So anyway, I recommend surveying people because one size will not fit all. And each person is going to have a different starting place. And I think we have to start with where they are. So if I go back then, I said I was going to talk about this fatherhood program. So the one program that was studied during COVID and looking at what were some of the changes that they had to make to maintain participation during this pandemic, the program Strong Fathers, Strong Families, it was in, like I said, it was in New York City. And their goal of the overall program, a little bit different from ours, but also very parallel, but it's to help non-custodial fathers become more financially stable, which oftentimes involves workforce, to be better able to support their families, both financially and emotionally. So the Urban Institute studied the program and they documented some of the changes that the program had to undergo in order to implement this new virtual type programming. And then they also interviewed participants and the staff on their experience and perceptions. And I'm only highlighting a few of these. We're going to look at 3 areas. One was intake and enrollment. One we're going to look at doing training, and one will be the case management. So before, when they were doing enrollment, eligibility and intake required that participants come in, complete all these forms in person with the support of an intake specialist. So they had to collect all the information and documents and do a needs assessment. And that was all in person. And then suddenly it wasn't feasible. So they had to move to a virtual enrollment. So they had 3 methodologies. They could do intake entirely over the phone and then have somebody mail something in. Some of the forms were digitized and uploaded using things like Microsoft Forms and Google Documents so that the applicants could be sent a link in order to be able to fill out this information online. And they also had to allow for and get a program to do electronic signatures. So in the end, participants now have 3 options. It could be done over the phone. They could do it almost entirely online, or they could do a hybrid where they came in and they did some in person, but they did a lot of it online. So what staff found has been the best system was using a hybrid approach. Do as much as possible as they could online or also over the phone, but they did want to do some one-on-one. What they said was that some data that is collected can be dependent on how it's collected. Like participants may be more or less honest on when they're given a form, or what the methodology was, and they had to always be given an explanation about why this data was even being collected. But they thought that doing more online and saving only the key parts for in person turned out to be their best strategy. The second major area then that they had to change was conducting workshops and training. So to give you a sample, I mean, they were doing similar things to what many of you do, job readiness. They also did parenting and healthy relationship workshops. But a lot of the workforce kind of stuff, resume writing, etc. So initially they were doing these classes in person, and it was a 2-week class, and people were there for 6 or 8 hours a day for this 2-week period. And then they also had training providers to do occupational and GED classes and that kind of thing. But COVID put a kibosh on all of that. So staff had to spend a couple months moving workshops to a virtual environment. So they did live sessions like you're in now. But they also recorded sessions, which is also happening now, for fathers who weren't able to attend for some reason. The virtual workshops were recorded, and so it just enables people to view the training when it's convenient to them. And like, I have a challenge with a year-long class that I'm teaching. And my class, I found that this one program, I don't get anything for recommending it, but it's called iSpring Cloud. And it allows me to upload presentations so I can send out a link and people can watch them whenever they want. And as an instructor, I can see who logged on. I can see how long the student watched the presentation. It tells me how many minutes. I can see how many slides they went through. So if somebody just turns it on, watches 2 or 3 slides, and then wants credit for attendance, and there were 30 some slides in the presentation, I know that. So I can reach out to those who are falling behind. I can upload these presentations, send them to anyone who's missed a session. And so regardless of schedule conflicts, everyone gets the same information. Staff at the Fatherhood program said this was much easier because fathers could participate in these virtual workshops. They didn't have to travel to a physical location, be there all day. But they could also assess what a father needed and only give them that. So if somebody already had a resume that was good, they didn't need to send them the link for the resume workshop. And they said, which I find interesting, that some of the fathers were more comfortable sharing personal details when they were behind a screen than they were when they were in person, which actually does make me think, because on Facebook and Twitter, 2 platforms I use, it's like people will say anything when they're behind a screen, but that they would not say in person. So, but anyway, the point is nothing works for everybody. And then the last major area was case management and referrals. Pre-COVID, everybody in the agency had very specific functions and they stayed within their function. So they were in a silo. After COVID, staff had to be cross-trained to do things outside of their silo, because it was difficult for the clients to be calling various people within the agency. So they wanted one person point of contact, and that ended up being the case manager. So what worked in an office environment didn't necessarily translate very well into a virtual environment. And what they learned was that they did need to increase the inherent value of the appointments to get people to participate. It used to be, and this is just a side note, they would give people a gift card for coming in for case management appointments. But now that they were doing it virtually, because of the time lag, now I send out a gift card and it goes through the mail and you don't get it for 7 days. It just seemed to have less value. So they needed to make their appointments more focused on the needs of the participant and on relationship building, and just less transactional in nature. So I want us to look at that, because I have a few recommendations. But before we go there, let's look at what some of the challenges were, because I think these are similar to what we experienced. I think they're considerations for all of us. Oftentimes the participant doesn't have a quiet place at home to engage in a virtual session. There's noise, there's children, there's lots of other things going on. Confidentiality becomes an issue. So you have to be sure that the person is free to talk and there aren't other ears where they're going to talk about something that these other people should not hear. One of the downsides is, unless you're using video, you can't see body language. You can't see body language with phone. You can't see it with texting. You can't see it with email. Participants, again, have limited technology. I think ACP will help us in that regard. But oftentimes they just don't have the skills. So you're going to have to do some training to help people see how to use these technologies, which again, I think is a good thing, because most jobs are going to require some technology, some familiarity. My brother Jim just got a job, and he's a maintenance person for a senior living facility. And one of the requirements is that he has to be able to use computers for timesheets, for work orders and stuff like that. And Jim is in the dark ages in terms of technology. And so he's had to learn it. He doesn't like it, but he had to learn it. Building rapport is more difficult. If there are school closures or children at home sick, that means that you've got kids in the background. But they also learned that classes were too long. And Kirsten and I were talking about this right before you guys all came on. And you can't do 6 hours. That's just impossible, which was like their classroom. So they had to chunk information into 1 hour, 1.5 hour type sessions because fathers couldn't participate. So what we want to do is look at a way to tackle some of these challenges. And I think that one of them is because technology may be unfamiliar, initially, you might have to focus part of your initial sessions on how to use technology or how to download and use an app. The good thing, again, is that it builds participants' technology skills. The exposure that they get and the confidence that they'll gain through continued use, I think, can help them in the job market. But the point is that lots of people are going to need training and confidence building. So you show them how to use it, use step-by-step instructions. When I'm teaching somebody even how to use like Indeed.com, as students, I like take screenshots so it can show them step-by-step what they have to do. And I'm a big user of YouTube videos. Like we couldn't connect a Fire Stick last night. So we go on, we watch a YouTube video and go step by step. That helps, but give me a set of instructions. I can't figure out where I'm at. So, or you could send them a video of the step by step, but you're going to assess this after a few sessions and see if it's working. Because some things can seem like it's great until you realize it isn't. And then always you're going to have a backup plan, no matter what technology you choose, because oftentimes there are failures or people just have this limited access. So, and some people, just regardless of their best efforts, maybe won't have the cell phone, or maybe they don't qualify for ACP and so they don't have a laptop. Or maybe the bill didn't get paid, so it got shut off. So we're going to, even though I have a paid up account, I've gotten logged off of Zoom right in the middle of a webinar. So it does happen. So you got to have if you have a plan A, use technology, you got to have a plan B, which will be paper package using the US mail, doing pre-recorded courses, or using the telephone. So one of the things that with that in mind, you still have to, during these sessions, set up the right environment. So if you're doing, particularly this slide has to do with doing video-based coaching, which I really like because it can establish rapport. All of those others, like I said, are one-sided. I can't see their I can't see their body language. I can't see their expressions. I can't see if they're distracted. And video, I think, is much stronger in that. But a few things. I mean, you want to have a quiet environment, simple background. I put up a curtain, and that's a shower rod behind me. If I'm doing something in an office and whatnot, I can wear headphones so that it's just me and them. And other people can't hear for confidentiality. You want to position your webcam so it's eye level, so that when you sit down, it looks like you're looking at them and not at your computers. You have to think about lighting, all of that kind of thing. And even what you wear is important, because dark colors are show up better on video cams than light colors or loud print. So you want to begin to develop website manner. But let's look at, what do you do at the beginning of the call? So the best practice for operating virtually are really grounded in the same principles of excellence in case management, no matter how it's practiced, in person or virtually. But there are a few extra steps that I might point out, like don't get right down to business. If your goal is to build a relationship, just like you would do in person, start with some social chit chat. Make sure that no one else can hear the conversation. In your office, you don't need to do that. But be careful how you ask. So you have to do it in a more unobvious way. Is now a good time to talk? Are you free to talk right now? Give the participant a chance to move or reschedule the meeting if something just isn't right. Find out if they have any topics that are important to them to discuss, because this has to be more about them, less about us. And then go over the agenda, what it is that you're trying to talk about in this, so that they know what to expect, because I think that that helps to set people at ease. So let me give you an example. Here are two examples of agendas. The first is very transactional, and it's not likely to build the relationship because it's all about business. The uninspired meeting is all about the agency's needs and is not about the participant. The second agenda that I have listed on the right focus more on the participant, her thoughts, her feelings, her needs. And so content matters. If the meeting doesn't have value to the participant, then they're going to be less engaged and less likely to tune in or even to return a call. So we need to think through how we can use this meeting to help the participant focus on her goals, her dreams, her progress. So notice that on my more engaging, find out if they're free to talk, find out like, how are things going in general? Then I want to go back and talk about what it is that she's working toward, getting her LPN, getting a job so that she can find a better place to live. Find out how she's feeling about the progress that she's making in that activity. Talk about any successes that they've had or any concerns. Set up a plan, work through a plan for what that person is going to do next. Then I'm going to talk about any documents that I might need, timesheets, schedules, billing from the school or university, because my needs should come second. And then I'll summarize what we've talked about, answer any other questions that they have, and then set up a next meeting. And it doesn't have to be an exact time, but it could be next month or the first week of next month. But if you look at the uninspired, that again is much, much more about us. So in the middle of the call, really the guts, remember, so that was just telling them what the agenda was, but the guts of the call, remember, we're talking about their goals, their progress, their successes, their challenges, how they're feeling. So what I encourage people to do is use motivational interviewing techniques, and that is asking open-ended questions. So you're saying, in essence, using open-ended questions is, tell me your story. I don't like to use with clients yes, no, because then they give you short answers. They're just trying to help you get through it. And so I want to expand the conversation. Use affirmations, and those are confidence builders, and they make people feel good. Affirmations are, wow, it looks like you've done a lot of thinking about that. You've done a lot of work. Wow, it sounds like you've made a lot of progress. And so I always look at places that I can say like, good job, and pat them on the back for their efforts. Use reflective listening. So repeat back what you think you heard them say. And always ask people's permission before you dispense advice. I think that a lot of times we think that people want our advice. And so it's like, I'll tell you what I would do, or here's what you need to do next. You really need to ask permission and say, I have some ideas about that. Do you think, would it be okay if I told you some of my ideas? You always ask permission so that it always is, puts the participant in charge, because it's their life, not ours. So let me give you a quick example of open-ended questions. Compare these two questions. What is the highest grade that you completed? Versus, talk to me about your schooling and education from high school to present. The material covered is identical, but the answers will likely be very different because the first question is a closed-ended question, and the expected reply is like 10th, what's the highest grade that you completed, 10th or 12th? And so it's transactional and it does not build relationships. The second question says, I want to hear about your story, what you think is important, and it builds relationship, and you still are going to get the information about their highest grade completed because they're still going to tell you the story. I went into school till my 10th grade year, and then things got rough and there were things going on in my family and I had to leave, blah, 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 blah. So you're opening the door and saying, I'm interested in your story. So try very hard to ask open-ended questions, because it says, I care about your opinion, I care about your story, I care about your experience. And then at the end of the case management session, we're still using motivational interviewing techniques. And so we're going to continue that right through the end of the meeting. So definitely leave time for questions that they have at the end. Summarize everything that you've agreed on up to this point and what the next steps are. And again, most of that should come from them. You said that you were going to do X, Y, Z, although some of it could be me. And I said that I was going to check with the job developer. And then again, paperwork comes last because that's your need, not theirs. So provide them any instructions about any after visit paperwork that may need to be submitted, tell them how to do it, which could be, taking a screenshot and sending this document, and then follow up with an email to document any important points of the call, so that everyone's on the same page. And while I said email here, I should back up and say whatever medium that they use. They might be more comfortable with text rather than an email, but to just document what we have talked about. So to add emphasis just on the confidentiality, we do need to assess and have safeguards in place when using the virtual realm. So we don't want to be discussing the client with other household members if they don't want that other person to know about their conversations. So the problem is we don't know who's listening on the client side, an abusive spouse or, just a roommate who they don't want in their business. So we have to assess that, which I said, we're going to say, is now a good time to talk? Or is it okay to have a discussion right now? So let them guide that. Because potential people could be right off the camera. So, and then I like to verify the person's identity. And I know that's weird, but I know that I have a deep voice. People, when I was growing up, would always say that you sound like Lauren Bacall, not that I sound like Lauren Bacall or look like her, but it's just my voice is deep. I get a lot of people who call the house on our house phone and they think I'm Tom because I must sound like a man. And sometimes, like, even when I call a rental car agency to set up a car rental, they'll say yes sir or no sir, and it's like, I'm a woman. Anyway, so I want to make sure that I'm actually talking to the right person. So and then again, give them time to reschedule if something's not right or I'm not talking to the right person. HEBA is not my area of expertise, so guidance on that, on any of these programs, would need to come from your IT department, states or feds. But you have to look at, is that platform HIPAA compliant? So next thing I want us to look at is when to use email, when to use video, when to use phone, when to use chat, when to use web conferencing. And I'm going to summarize this. I actually have a slide for each of them, but virtual case management can take advantage of all of these different communication platforms. And I think that agencies have to consider which technology is most appropriate for their needs and which makes sense for their participants. But different technologies do work better for different purposes. So for example, texting in Facebook is not a good method for delivering bad news or trying to delve into some complex issue. Phones work, but you're going to miss out on all those body language cues that you're going to get if you do video chat or video conferencing. So technology is most appropriate for specific uses. I mean, I have to look at what's the level of formality. Do I want to be formal or chatty? Text allows for much more chatty because you can also use emojis and happy faces and whatnot, but it's not very formal for the kinds of questions that some of us might want to be asking. What I want to just say overall is that I know for the 160 students that I have in this class that I teach, that video conferencing seems to be the least used by workforce agencies. But I would argue it gives you the most opportunity for building relationships. Next to one-on-one in person, it's the best option for having case management meetings. All the other communication methods, email, phone, text messaging, like I said earlier, they're blind. You can't see them, they can't see you. And so they lend themselves to more transactional relationships rather than building these stronger relationships when you can see each other. With video, I can see the person, I can see their expressions, I can see if they're distracted, and there's built-in accountability. So they have to stay more engaged because they're looking at a camera. And, we use it all the time in meetings like this, but just not as often when we're coaching clients. So I, in general, think it's a tool that's underutilized. It does require that both parties have the app. Like even with Zoom, the first time you have to download some little program into your phone on your computer. But I think that's an easy process. Because oftentimes it's just a matter of a client clicking a link for an invitation. I have a 98-year-old uncle who joins these kind of video chats with all of the family. And I was shocked, like him and his wife, who I think is 96, they're able to join our Zoom meetings. He just couldn't figure out how to make the camera, like we'd oftentimes be looking at his chest instead of his face, but whatever, at least he's on. So in conclusion, there's really no manual for what works and what doesn't, mostly because this is such a new area for workforce programs and other social service agencies. So it's all new. So I think that we have to adopt a test and learn mentality and just change what isn't working. So just like telehealth is, keep track of the changes that you've made and the challenges that you face so you can keep reflecting on and learning from the experience. I think as we're all learning to use these technologies in new and different ways, we're expanding our skill level as well as the clients, and we're helping give them confidence in using technology. And so I think we can use this to provide more of our services remotely, and we gain all those long-term benefits. What I think is next is that IT, we have to invest because we're going to need access to programs, the tools, the equipment, really at everyone's desk so that they can participate in video chat or text messaging. And oftentimes that means we have to get approval to use things like Facebook and other kinds of things or other social media platforms. We have to learn to expand our case management skills to encompass virtual, because like I said earlier, there are some differences to doing video presentations and video case management versus being in person. We have to test what works, what doesn't work. We have to try to organize our meetings in such a way that I engage the person, which, as I said, I think motivational interviewing is a real important key in doing that, because that's all about the client and a whole lot less about us. They should be doing most of the talking. And then we need to find out and research and do surveys to figure out what do participants think about this new way of offering services. And we might find, just like telehealth did, that they're very satisfied and want this to continue because of the convenience and they can do it when they can do it from home and not have to drive to our offices. And then it's just looking like the fatherhood program did at the balance between virtual versus in person. So trying to develop these, figure out what's the right balance with hybrid services. So I'm going to open this up for questions, but I do want to thank you for joining me today. And I want to make sure that I don't forget to wish you a healthy and happy holiday season. So let's move to questions. And I do see some chat.
Yeah, there's some that you can ignore actually, Jody.
Okay.
Because it was a bot that I had to kick out.
Wow,
But
bots can get in. Oh, you have a confidentiality and security issue.
yes, we need to take care of that, and it's a live link on our website. So, but we take care. I took care of it. I kicked them out, but I just don't want you to pay attention.
Okay.
So we did have a question from Christine. What was the name of the program software that you used where you post a training presentation and participants can see and you can see participants' progress?
I want to make sure that I get it right. So I'm going to switch back through my page. It's iSpring Cloud. I like I spring, like the season, and then cloud. And they actually have a lot more capabilities than what I purchased for my needs, but they can, like, I use their storage system so that I can monitor who's doing what in my class. So ispringcloud.com.
Cloud as in like a cloud in the sky.
Yes. Sorry, I did the I in the spring, but forgot about that last part.
Mhm.
Okay.
I think
there it is.
I put the website in the chat for everybody. Awesome. And then while everyone, if anybody has any questions, feel free to type them in the chat or the Q&A. I will be monitoring them. And then while you all are thinking of your great questions for Jody, I'm just going to reiterate that we do have a follow-up survey, and you will receive that in your follow-up email tomorrow, along with the link and the which has the presentation and the recording on it. So here is the follow-up survey. I'm going to put that in the chat now if you want to take it right now. I know I like to take surveys. If I'm going to take a survey, I'm going to take it right away while the session is fresh in my mind. So. And then if anybody has any other questions, I don't see any coming in through the chat, Jody.
Yeah, and my email address is on the 4th slide, I think, or maybe it was the 5th. I have that. So people feel free to email me and reach out if you do. Hopefully I hit upon all of the issues. I wanted to look at what the challenges were, what the benefits are. You know, there's so much more that you can say. And as I was telling Kirsten, I have had a longer session, but I was going through thinking if I was, because I was a case manager, what are the kind of things that I want to hear? And so, like, not only what's the technology, but, you know, what's some of the methods. I mean, I know since COVID and everything became webinars, I had to learn a lot about doing online presentations because it is so utterly different than doing them in person. So I hope over the last couple of years I've perfected my skills. So they can reach out to me directly as well.
Awesome. And I put your email in the chat for everyone.
Okay, great.
All right. Well, if there's no questions coming through, I'm going to go ahead and close us out. Thank you so much, everyone, for joining us. This was our last Workforce Wednesday webinar before the holiday season. So we will not have one for the next couple weeks, but we will be joining you back on January 11th, I believe, is our next Workforce Wednesday webinar. So we will have our January professional development coming out on our Monday marketing. So be sure to check that out. We have 3 or 4 great sessions in January and a lot coming out in the spring as well. So be sure to keep up to date with that. If you're not on our marketing listserv, feel free to shoot me an email and I can add you to that. Maybe you joined this session via our website or via a coworker who sent you the link. But if you want to keep updated on our marketing, feel free to email me and I'll add you to the list. So I put my email in the chat for you all. And then I'm just going to reiterate, thank you, Jody, for joining us again. We always welcome you and we're always excited to have you present to us. You are a wealth of knowledge. And so we're grateful that you want to share that knowledge with us. And thank you everyone for joining us this Wednesday. Have a great holiday season and we will see you back in January.